First of all, I want to thank Shannon Putnam and Margaret Bailey for having me as a speaker. I was so excited when Shannon approached me to come talk about my journey across the United States. However, unlike Jamie, I tried to choose the shortest route across the United States. So I went from the southern route, which is more flat, which I admire. 100 days, 3,300 miles. Well, again, my name is Chad Sigmon. I want to thank Highland Hospital for the opportunity to speak here tonight about mental health awareness. Recently, I decided to run across the United States to eliminate the stigma associated with mental illness. I started in Jacksonville, Florida on April 1st and finished in July in San Diego on July 30th. The journey took me 121 days, close to 2,500 miles. I averaged around 22 miles per day. Mental health awareness. It's a cause that's very close to my heart. I myself suffer from obsessive-compulsive disorder and clinical depression. Suffered from obsessive-compulsive disorder most of my life. And mental health, it's this topic many people are afraid or ashamed to talk about, let alone to get help for. I'm so happy Highland Hospital is in Clarksburg, West Virginia, to educate and help our community. When I was younger, I wish we had this facility for me. A lot of times, correct diagnosis is so important. As a young kid, I didn't know what was going on, and I suffered for silence for many years. So it's great, it's here, and I'm proud. Knowledge and educating individuals is the first step in recovery. Some individuals that are suffering from a mental illness, like myself, may not even realize that they have one. I myself suffered in silence, as I mentioned, for many years. I thought my rituals and compulsions from the OCD, obsessive-compulsive disorder, were just normal ways, just part of me, to deal with my anxiety. I did not realize I had a severe anxiety disorder, which in turn, later on in my life, turned into clinical depression. A lot of people suffer in some ways from obsessive-compulsive disorder. Some individuals say, jokingly in the mainstream nowadays, I'm so OCD. Most of the general public think OCD is just about having things arranged in a certain order. Yes, this is one type of the OCD symptom. However, let me tell you, OCD, it could be a monster. It was not until I turned 19 that I needed to get professional help. I don't know if it was my year in Finland alone, in isolation, not knowing the language, a lot of time on my hands. But when I got back, I thought alone that OCD got more and more severe. My minor symptoms, such as the counting, rearranging, repeating, and checking, it turned into something new that I haven't experienced before. And a lot of people are unaware of a type of OCD called pure O. They could be intrusive, unwanted thoughts. Everyone has an intrusive thought from time to time. It's part of being human. The difference is someone with OCD, the OCD will not allow the sufferer to stop thinking the unwanted thoughts. The more we try, the stronger the OCD becomes. We put some type of significance or some importance in the thought. We're wondering why we had it. When intrusive thoughts occur with the obsessive-compulsive disorder, individuals are less able to ignore the unpleasant thoughts. This causes the thoughts to become more frequent and distressing. The thoughts may become obsessions, which are paralyzing, severe, and constantly present. It can range from thoughts of violence, sexual thoughts, to blasphemous thoughts. OCD can make the individual feel like being evil for having these unwanted thoughts. This is, I'm going to go over some examples, the severity of OCD can be, which many of you probably do not know. It could be, as I mentioned, I'm talking about the type of the aggressive, harmful thoughts. Some examples of inappropriate aggressive thoughts are imagining or wishing harm upon someone close to yourself, or having images of harming yourself. Could be causing harm to the elderly people, impulses of violently attacking, hit harm a person, a child, or animal. The list goes on and on. These thoughts can be so bad that the sufferer will choose to avoid your loved ones and isolate yourself. I did this for many years. Lost many friends, a lot of people not understanding why, because I was too ashamed to even mention I had these thoughts. When a person is experiencing aggressive thoughts, they may feel shame, guilt, distress, torment, or fear of acting out on the thought or personal or perceived impulse, and even doubt about whether they have already acted in such a way. It can be very graphic images in the thoughts. So, depression may result in of the self-loathing that can occur. Can you imagine having unwanted, intrusive thoughts in your head for hours, stuck upon hours, days, months, and even years? I myself suffered from silence from many of those thoughts that I mentioned earlier. I began to self-medicate with alcohol. I drank a lot. Self-medicating is a double-edged sword. It can relieve many of the symptoms for a few short hours, and at the time, those hours were worth it to me. However, the OCD monster would be 10 times stronger. It was a vicious cycle. The drinking, of course, is a depressant, and it could cause me more and more anxiety. And so it became a vicious cycle. I had to drink to get rid of the anxiety. This had occurred for many years for me before I got the proper treatment diagnosis. At first, they thought I had bipolar disorder, which in fact was just, once I went to a hospital in Wisconsin that specialized in OCD, I realized I just had a very severe form of OCD. I think it is really important for individuals, friends, and parents to be aware of the symptoms of anxiety disorders, depression, and other mental illnesses. This way, they can get the help early on. And this was one thing I know Highland Hospital here in Clarksburg is going to make a difference for young individuals and older. No one should feel ashamed to ask for help for a mental illness. Mental illnesses are chemical imbalances. Would you be ashamed to get help if you had diabetes? Would you take insulin? I'm sure you would. There's no difference in getting the proper care to treat a mental illness. I decided to go out of my comfort zone and share my experiences so individuals would feel comfortable to talk with me. Many people may feel all alone. I want them to know that they are not alone out there. Did you know that 1 out of 4 people will suffer from a mental illness within their lifetime? Staggering. With proper treatment, individuals suffering can live productive lives. With proper treatment through medication, cognitive and behavioral therapy, many of the symptoms of the disorders can be managed. I want to stress how the mind and the body go together. With regular exercise, good diet, keeping busy, hobbies, and prayer can help keep a healthy mind. I'm the one of the lucky ones. I'm so lucky to have such a loving and supportive family that many individuals with mental illness do not have. I do not know where I would be without them. If it was not for my friends and family, I would never have been able to complete my goal of running and walking across the United States. My father took 4 months out of his life to be there with me on this running journey. My dad is an amazing man. He deserves so much of this credit. There were times for me when I thought I was going to quit. Texas is a long state, 900 miles. I felt like my dad had it much harder than me while I was running and enjoying this beautiful countryside that our great country has to offer. My dad was in a hot RV waiting for me every few miles, having water ready, just waiting. He also had prepared our meals, took care of every problem on the RV that we encountered, and that's a story in itself. He had many, many problems. My dad averaged only a couple of hours of sleep over a 4-month period. He also had to go to the emergency room twice, but yet he still wanted me to finish. He was there every step of the way to provide me with encouragement and love. I want to thank my mother for allowing my dad to go on this journey with me and my dog Madison. And my mom was stuck here by herself, alone for 4 months, but luckily, great. Forgot how amazing Clarksburg is with great close friends that took her out to dinner once in a while, so it was nice. Also, I want to thank my brother Ryan for creating the www.runchad.com website and also my Run Chad Facebook page. When I first started, I wasn't really thinking about doing it, but it caught on, and I'm glad I decided to blog. I had so many people from the community that were following me on the journey. Many people here were so generous and donated to the cause. There was a time in Texas when I just wanted to quit, as I mentioned. I remember the day I was laying in bed. I said, I don't want to do this. I'm just exhausted. However, one of my friends, Lucas Grimes, I was reading on Facebook, and without me even knowing it, though, she was creating a benefit on the Run Chad organization. Christy mentioned that she had suffered from agoraphobia, which is hard to leave the house, and she organized this benefit for me and told me how it gave her hope and to go out and had a purpose. And when I read that on the Facebook, I got up right away. That got me going, just to see what others are going through and that we're not alone out there. We met so many interesting people on our journey. It was not a coincidence that we met so many people that would come share their stories, either suffering with a mental illness or knowing someone who suffers from one. When I was running, I met many, with Jamie, I'm sure it's encountered. Our country has many soldiers that are coming back with post-traumatic stress disorder. And a lot of people just want to have an ear, have someone to listen to, someone to understand them. Even though I was never in combat, I did suffer from mental illness, and they felt they could relate with me. And I feel that we're helping one another. We met many other interesting people and learned a lot about this country along the way. In the state of Arizona, I found the fact that they do not offer any treatment in mental health unless you become a threat to yourself or others. That's here in the United States. Something needs to change until it comes to that point to get help. One thing I learned on this journey is to think about things that we're grateful for. I learned on this journey that I'm grateful for such a loving and supportive family. With a loving family and God, it really helps the healing process of someone that suffers from a mental illness. I want to introduce my father, Charles Sigmon. He's here. And there's a couple of stories where while I was running, he really got to meet with the people. And I'd like to have him share a couple of our experiences. So, Charlie Sigmon.